Assalamualaikum warahmatullahi wabarakatuh to the lecture and fellow friends. So today we will discuss a case study PHC 460. So before we start, let me introduce ourselves. My name is Nurani Sofia.
My name is Nuri Fanshira.
My name is Nazira.
My name is Sarata Alamia.
My name is Miss Fatina Natasha binti Anasa.
So we are given a case study. So based on the case study, a patient Lechini is 7 years old. 7 years old with an uncommunicable medical history. She has a normal motor medical development, but she was admitted to the hospital UIDM in China because of several symptoms. So based on the case study, we diagnosed that Lechini has Hashimoto Thyroiditis. Hashimoto Thyroiditis is chronic autoimmune disease. This disease occurs when the immune system creates autoantibody, which is anti-TPO and anti-TG. Anti-TPO produced will attack the enzyme needed to make the thyroid hormone, while the anti-TG will attack the thyroid globulin. This attack will lead to this destruction of thyroid follicular cell and result in hypothyroidism. The symptom of Hashimoto is a goiter, fatigue, and dry skin. So why we diagnose that she has a Hashimoto disease? Because based on the case study, we found that she has a painless goiter, which is a diffuse goiter grade 3, difficulty swallowing, and her BMI is underweight, which is lower than 18, and her head slightly below the average. For the lab test result, we found that she has a low plasma triiodothyronine and free thyroxine hormone. She also has high level of thyroid stimulating hormone and elevated anti-TPO and anti-TG. For the medical imaging result, we found that she has hypertrophic thyroid on the ultrasound with the uniform parenchyma and no focal nodules. So this medical imaging is being tested to determine whether the nodule is more likely to become cancerous. Not only that, the echocardiography and electrocardiography being tested to confirm that Lechini has Hashimoto, and the result was no sign of heart complication were found.
Okay, so next I'm going to explain about the pathogenesis of Hashimoto thyroiditis. So Hashimoto thyroiditis can be triggered by several factors, which is genetic, diet, and also certain drugs that can cause damage to the thyroid gland and also leads to the death of thyroid cells. So TG in healthy person, TG which is thyroglobulin, a glycoprotein, and also TPO which is thyroid peroxidase, an enzyme, both have essential role in synthesizing the thyroid hormone T3 and T4. It's actually located inside the thyroid tissue, which is in the thyroid gland. So due to this Hashimoto thyroiditis, since the thyroid gland is damaged, so the TG and TPO will be released into the bloodstream and will be engulfed by macrophage and will undergo phagocytosis. So after undergo phagocytosis, the TG and TPO will be presented on MHC class 2 receptor to the T helper cell, which is also called CD4 plus cell. So some people with an LN, HLA-DR3 or HLA-DR5, which is a genetic marker, can present this TG or TPO as a foreign body to the T helper cell. So this will make the T helper cell recognize TG and TPO as an antigen and not its own body cell, and will become activated. So the activated CD4 T helper cell will induce the activation of B lymphocyte, which is, as you can see by the diagram, is actually autoreactive cell. Autoreactive cell is the mean of autoreactive cell is actually immune cells that attack its own body cell. So the activation of B lymphocyte will actually produce antibodies, which is attack the TG and TPO, which is called anti-TG and anti-TPO. So the constant stimulation of autoreactive B lymphocytes will cause overproliferation of B lymphocytes, autoreactive B lymphocytes that can cause the increased level of anti-TG and anti-TPO, which is what we can see in the diagnosis of the patient leukemia. So as you can see by the diagram, the CD4 plus T cell also helps in activating the CD8 plus cell or cytotoxic T cell, which is also an auto-reactive cell. So this activated cytotoxic T cell will release granzyme, which will make the thyroid cell undergo apoptosis and leads to the death of thyroid cell. So the thyroid cell death will lead to hypothyroidism, which is the decreased level of thyroid hormone T3 and T4. So in a healthy person, as the T3 and T4 level decrease, the pituitary gland will actually produce more TSH, which is thyroid stimulating hormone, to stimulate the thyroid gland and increase the T3 and T4 level back to the normal level. So the high level of T3 and T4 level will actually send signal to the pituitary gland to stop stimulating or producing more TSH. So, but due to the thyroid gland damage, it cannot function properly and cannot produce more T3 and T4, even though the pituitary gland actually keep producing TSH and to compensate the level. So as a result, the T3 and T4 level is actually remain low and the TSH level is high, and this high level of TSH is actually the key indicator of Hashimoto thyroiditis, and also can cause to the enlarged thyroid, which is called goiter, which what we can see in the diagnosis of our patient. So next.
Okay, now let's move on to question 3. What are the risk factors from genetics, diet, and drug perspective? Okay, first of all, the genetic perspective refers to inherited traits or gene variations that can make the immune system more likely malfunctions. Also, genetics can be linked to family history. For instance, if the parents or siblings have the autoimmune disease, therefore the other family members also have higher possibility to develop the same autoimmune disease. Next is diet. The dietary perspective involves how the nutritional intake and nutritional balance can influence the risk of autoimmune disease. And lastly is the drug, where it focuses on how certain medications can interfere with this immune system regulations. Now let's dig deeper into genetics. Here I have 3 main points that I would like to explain, starting with HLA genes, also known as human leukocyte antigens genes, where it helps the immune system to recognize self versus foreigners. In autoimmune disease, certain HLA types like DR3, certain HLA types like DR3, DR4, and DR5 may mistakenly present thyroid proteins such as TG, thyroglobulins, to immune cells. And this misrecognition could lead to autoimmune attack, where the body will start to attack itself. Interestingly, HLA-DR13 play a protective role where it can help to suppress the overreactions by enhanced immune tolerance. Next is CTLA-4, a checkpoint protein that can act as a brake on T cell activity. If CTLA-4 is mutated or dysfunctioned, the braking mechanism fails. Therefore, T cells will become hyperactive and wrongly attack healthy thyroid tissue. Eventually, T cells will stimulate B cells to produce autoantibodies. And lastly is PTPR22, which is a type of genes that controls how strongly T cells can respond to danger signals. If mutations happen here, the T cell will become overactive. Therefore, the aggressive T cells will stimulate B cells to produce autoantibodies against the SHR. This could lead to immune-mediated destruction and inflammations. In our cases, such as leukemia, where she's experienced Hashimoto's disease. Next, let's look at the diet perspective, starting with excess iodine. Okay, iodine is essential for the thyroid hormone production, such as T3 hormone and T4 hormone. But too much of iodine can be harmful. For people who are genetically at risk, excess iodine can increase iodinated protein, which will trigger autoimmunity. Common iodine-rich sources include salt, fish, and cheese. Next is selenium deficiency, where selenium helps to protect the thyroid from damage. Selenium will help to protect the thyroid from oxidative stress through an enzyme called glutathione peroxidase. If selenium level is low, the thyroid will become more vulnerable to damage. Therefore, this will raise autoimmunity risk. Brown nuts, meats, and fish are key selenium sources. And last but not least is iron deficiency, where iron is actually crucial for the activity of the thyroid peroxidase, TPO, which is an enzyme that is responsible for the production of thyroid hormones. Without enough iron, the production of hormone will reduce and the symptoms of hypothyroidism will worsen. Iron is abundant in red meat, spinach, and also veggies. This is the sources that I had mentioned before. So in conclusion, the nutritional sources need to be taken balancedly, so that too much of it or too less of it, because too much of it and too less of it can be harmful. Okay.
Alright, next let's look at drug. How drug can play a major role in large risk case. The first drug is amiodarone. Amiodarone is a strong anti-arrhythmic drug that is usually used to treat serious arrhythmias, and it contains about 37% of iodine, which is far more than our daily requirement. For normal people, as you all know, in thyroid, iodine is needed to make up the thyroid hormones like T3 and T4. But when the level is too high, the thyroid itself can shut down the hormone production temporarily, and this phenomenon is called as Wolff-Chakoff effect. For normal people, for normal people, thyroid can escape this effect only for a few days. But for people who are genetically prone to autoimmune disease, their thyroid can be failed to recover, and this leads to hypothyroidism, thyroiditis, and even trigger the production of autoantibodies such as anti-TJ and anti-TPO. Other than that, amiodarone also has a long half-life, so the effects on thyroid may stay longer and can last for weeks and even months. The second drug is lithium. Lithium is commonly used to treat bipolar disorder, but it is rarely administered by children. Lithium, however, it can also give side effects on thyroid glands. Like lithium can inhibit the release of thyroid hormone, reduce iodine uptake, and also impairs the synthesis of thyroglobulin. It also can promote the development of goiter, especially when it is taken in long term, and this can cause the thyroid becomes enlarged. Even the patient cannot feel the pain, just like how Lakshmi experienced. And lithium intake also can induce autoimmune thyroiditis. Lastly is interferon alpha. Interferon alpha is a drug that is used to treat chronic viral infections and some cancer. It is actually act as immune system stimulant for normal people, but for people who are genetically prone to autoimmune disease, the immune stimulation can be backfire, where the thyroid itself can become more visible to immune system by increasing its MHC class 1 on its surface. So the immune system can be mistakenly attack the thyroid cells. Other than that, it also can trigger the production of autoantibodies or anti-thyroid antibodies.
So next we move to the treatment and management. For the treatment is levothyroxine. the thyroid hormone, which is naturally produced by the thyroid gland. So levothyroxine used to replace the hormone that body cannot produce enough T4. So for the dosage in children, based on MIMS Malaysia 2025, for initial dose 12.5 until 50 mcg per day, and adjust every 2 to 4 weeks based on the clinical response and TSH and thyroid hormone levels. For maintenance dose 100 until 150 mcg per m square daily, and it is given as a single dose. And for Lechumi's cases, as she is only 7 years old and her weight is her weight is 15 kilogram. So typical dose may start around 3 until 5 mcg per kilogram per day. So for the mechanism of action, based on this diagram, when levothyroxine is entered the body, enter the bloodstream, it will converted to T3, which is active hormone, and T3 will bind to the T4TR, which is thyroid hormone receptor complex. Thus, it will activate metabolic processes, which is produce energy, and also trigger anti-inflammatory and gene regulating pathway. Instead of using levothyroxine, long-term monitoring also essential in order to ensure that correct dose is monitored, and also to ensure that no signs of overdose and under treatment. So firstly is thyroid function test, which TSH concentration and free T4 levels are monitored during and after treatment. Secondly is symptoms and signs of overdoses when over-consuming levothyroxine. Hypothyroidism-like symptoms may occur, such as tachycardia, palpitation, and insomnia. And lastly is for physical examination. For example, routine weight measurement, thyroid measurement, and also pulse and blood pressure measurement. For thyroid measurement, can be monitored by palpating the neck area for goiter size, nodules, and also the changes of thyroid gland. For pulse and blood pressure measurement, when high pulse and blood pressure measurement indicates that the possibility of excess thyroid hormone in our body is increases. So
as conclusion, we conclude that Lechumi's condition is diagnosed as Hashimoto's disease, Hashimoto's thyroiditis, which is an autoimmune disease. So it can be due to several factors that we mentioned earlier. It can be from drug factors, genetic, and diet imbalance. And early diagnosis and proper thyroid hormone replacement can support the growth and preventing the complications of Lechumi. So that's all. That's ours. This is our reference. Thank you.
That's all from us. Thank you. Do you guys have any questions?
Yes, I have question.
Alright.
Yes.
What is the difference between Hashimoto's and Graves' disease?
So Hashimoto thyroiditis is actually autoimmune disease that is that cause damage to the thyroid gland, while Graves' disease actually autoimmune disease that cause overstimulation of thyroid gland. So differences between the thyroid hormone is actually T3 and T4 level is low in Hashimoto, but the TSH level is high in Hashimoto thyroiditis disease. But in the Graves' disease, the T3 and T4 level is high, but the TSH level is low. And then the main antibodies in Hashimoto thyroiditis is actually anti-PG and anti-TPO, while in